All right, so this is how you're going to prepare for patient intake on your surgery practicum week. The first thing we want to do is prepare our chart, and you have a nice little demonstration right here on what the outside should look like, and then a chart right here on which form should go on which side and in what order. So I'm going to go over here to our drawer with manila folders, and then right here we have our chart labels. Most often our animals will be forever home dog rescue, so unless we tell you otherwise, you can go ahead and prepare that way. So I'm going to get my FHDR stickers. And as you see, they are on the side over here. You can also put them up top. You just don't want to cover your tag right here. This is where your patient's name will end up going. So I'm going to just put them right here. FHDR. So the goal is to get all of this paperwork as prepared as possible before our patient gets here. The other thing I want that is also in this drawer is a year sticker. This makes it easier for us to keep track of relevant and active records. So I've got a 19. I'm just going to sit it over here by where the name's going to go. All done. Then I'm going to look at my chart here, and it tells me exactly what forms I need to get. So I'm going to get a client information form. They are right here and already signed. So it's already signed. And then I've got a doctor's order checklist. Post-operative drug form. And then your drug fluids, or your drug and fluid calculations will eventually go in the back, but we do have a drug list of all the drugs that we use here that we like to have in their folder as well. Then for the right side, I'm going to get a soap form. There is a back, but if you think you may need more room, there are blanks here as well. Treatment sheets. I need enough to cover the entire time they're here, so Monday, Tuesday, Wednesday, and Thursday. I'm not going to actually put these in my chart right now because I'm going to make my treatment sheets up since it's Monday. Then I need my lab form. This is where we record all the labs that we do while they're here. My anesthesia form. My discharge instructions. Another blank form to be filled out at discharge. And then once we get our certificates, after surgery and after their vaccines, they'll go in the back of this. Okay. Some of them aren't hole punched. We just grab our little hole puncher. Okay. We've got our left side and our right side. So my drugs go on the back, the medication list. Then my post-op orders, then my checkoff sheet, and then my client agreement form. On the right side, I have discharge, anesthesia form, lab form, soap form. The other thing I want to go ahead and grab that I will need is my surgery sticker in the box right here. I'm not going to unstick it, I'm just going to rip it out because I don't know exactly where it's going to fit on my soap yet. So I'm just going to keep it in the chart with me here. Your surgery day, you'll go ahead and put it right after all of your notes. So the next thing I want to do is go ahead and start filling out everything I can. So I don't know my patient yet, but I do know that my surgery date is 6/12/2019. I'll put my first and last name under student. And again, I already know that the owner is Forever Home Dog Rescue, and I can just write FHDR. The more you do ahead of time, the less you have to worry about later, and then you don't miss anything. So now I'm on the post-operative, and the week is that first Monday, June 6th, or June 10th, excuse me. All right. Admission date would be on Monday. The technician is me. Again, the owner is Forever Home Dog Rescue. I don't know what's coming in. I do know it's a dog, though, so I can go ahead and write canine. If you happen to know what sex you're getting, because maybe you need a spay or you need a neuter, you could go ahead and circle that. But the rest of that's going to stay blank for now. But again, everything needs the name, so I'm going to write name again, owner. And then on the lab form, I'll write intake day because we do some of the labs on that day. My anesthesia sheet, if you already know who your instructor is and your assistant, go ahead and fill that in. Otherwise, you can put your name, the date of your surgery. You should know what date your surgery is. Again, I know I'm getting a canine, so I can go ahead and write that in. And maybe I know my procedure is an orchiectomy. You do want to make sure you write out orchiectomy or ovariohysterectomy. Again, discharge, I'm just going to write what I can on it. All right, so that's my chart for now. My surgery sticker back in it. Now we're going to work on the treatment sheets. So you should have enough time to do all of this because intake starts at 12:30 and she's not normally here till 1:30, so it gives you a lot of time to get all your paperwork ready. So for my treatment sheets, again, there's a lot I can kind of pre-fill, and I can also pre-highlight some of the stuff. So, again, I don't know my patient's name, but I can put myself down. I like to do each treatment sheet fully at one time, because then I know when I'm done with it, I'm done with it. So, date for Monday is 6/10. And then Monday, and then don't forget there is a spot on the back, and that has to be filled in also. So 6/10/19, and that's a Monday. So, got this nice little animal care guidelines sheet that you guys will have. I made you some copies. This is also hanging up in the kennel room. It tells you when we do everything. Like if you're curious, when do we do our TPRs? When do we call Miss Kelly? It's all broken down in here by time. So I look at my 8 o'clock and it tells me I've got TPR and weight, attitude, appetite, food, water, walk, medications if indicated, and then call Miss Kelly. So I'm going to make sure that I highlight all of those things. So Monday is TPR, weight, attitude, and appetite. We will be feeding, 8 o'clock in the morning. We will water and walk. And then I want to call Miss Kelly. My afternoon, my 1 o'clock, we don't TPR or weigh. We just go to attitude and appetite. We don't offer them food again either, but we do walk and make sure that they have water available. My 6 p.m.s look just like my 8s, except I'm not going to call Miss Kelly again. We only call her in the morning. We'll feed again, and we'll walk and water. And then my 10 o'clocks, it says on here, TPR post-op patients only. Okay, so we don't do the TPR and weight at 10 o'clock regularly. We only do that when it was their surgery day. Then we add in an extra one. So I'll skip those and I'll just go to my attitude and appetite. Again, we won't be feeding, but we will water and walk. Okay, so this animal's surgery is on Tuesday, so the Tuesday one will look just the same. I'm going to go ahead and skip to a surgery sheet so you can see what that will look like. So 6/12 of 19, Wednesday, is this animal's surgery day. Again, I kind of just make it a habit of always flipping it to the back and going ahead and writing it in. Otherwise I forget. 6/12/2019. All right. So, as always at the 8 a.m., we will do a TPR, a weight, attitude, and appetite. Well, we're not going to feed them, so appetite you don't have to highlight if you don't want to. My food, I'm going to, we don't want them to eat, so I'm going to go ahead and write NPO, non per os, and same with their water. And then call Miss Kelly. And it's fine to highlight those if you want to make them a little more noticeable, as long as it says NPO on both. Then at my 1 o'clock, I'm not actually going to write anything in. I'm just going to note that this is surgery. So I like to actually make a little box from noon out to about 5. I'm just going to box the whole thing out, just noting that this is the time frame that will be happening. This also makes it really obvious for anyone looking at the treatment sheet. If they were to accidentally feed, they'd be like, oh no, this is surgery day. It pops out at you, right? So I will put my 6 o'clocks down, whether we're done with surgery or not, who knows. But you'll note on your animal care guidelines, it does say that there's some post-op instructions. So on the treatment sheet, there is a pain score and a check incision. Post-op is when this stuff becomes relevant. So anytime we get that patient out, 8s, 1s, 6s, or 10s, we will be assessing pain score and we will be checking on that incision, seeing what it looks like. So again, my 6 o'clocks are a TPR, a weight, an attitude, and appetite. But now I'm going to include pain and incision. And of course, we're going to feed and water and walk. The other thing to do on your surgery day is part of your requirements post-op, once your animal is recovered and back in their bed, is to notify the owner that everything went well. So to remind yourself, you can put a spot on here. So what I normally do is, and it is on your treatment sheet, it says contact owner. I just open box like a good 3-hour time period, since we don't know exactly when it will be, from 5 to 7. And if it doesn't end up being one of those and it's later, that's fine. Just sign the box that it goes into. This is just a nice area to remind you. So before you leave, you're looking over your treatment sheets, making sure everyone's done, and you're like, oh no, I have to email the owner still. I'm going to do the 10 o'clock. So again, this is a surgery day, so this is a post-op patient now, so I will do a TPR and weight at the 10 p.m.s. I will also now include that check incision and pain score. No food, but we will water and walk. There may be medications and stuff, but you don't want to highlight anything until you actually have information to go into the box. So yeah, we're probably going to give post-op meds, but I don't want to, you never want to highlight something if nothing's indicated there, because then anyone could write whatever in there. The other thing I want to show you is for my prior to surgery day sheet. So this would have been my Tuesday sheet. One other note that you would want to make, you don't actually have to highlight it, but on the food for 10 p.m., you want to write pull. Okay? They can keep their water, but as far as the food goes, at the 10 p.m., you would write pull on it. Okay. Then for your Thursday, which is your discharge day, again, always in the morning, we're going to TPR and weigh, do an attitude and appetite, and then again, because they're a post-op patient, we will check their pain score and their incision. They're going to get some breakfast, and they'll get water and walked. And always call Miss Kelly at 8. The last thing we do on Thursday is our discharge day, so it's up to you if you want to just box out that it's discharge. We prefer you guys to do a TPR at a minimum on discharge day, since we regularly we give vaccines and we want to make sure we have a fresh TPR. So I like to actually just highlight the TPR one, just to remind me that we're going to do that. And also we like to walk them so that they don't make a mess in the rescue's car when they go to leave. Okay. But again, I'm going to go ahead and just write discharge. And I'm going to put a box for a couple hours because it's going to take somewhere between noon and 3. It'll happen. And these will go onto a clipboard in the kennel room. You want to go to kennel room? You guys want to come look? You can see where the other stuff is. So you want to grab one of the blue clipboards. These are the clipboards we use for our treatment sheets, all right, not the brown ones. And then while I'm in here, I'm going to go ahead and grab myself a collar and a cage card. So both of these are just tucked up under here. Grab one each, and we'll carry this stuff back out. Now, these are ready, saved for updating with my patient, just like my chart. I still have to update with my patient. I can get my tape a little bit ready too. So it's all about trying to think of all the things you can do before your patient gets here. With the ID collar, a couple things. You want to write on the matte side, not on the shiny side. So you can see this side here is shiny. All right, I want to write on the matte side. Also, the sticky side is up, if that helps you remember. But your ink will slide right off of this slick side. The other thing to consider when you go to write your information on here, you want to start at the sticker, because let's say I have a really small patient and their neck's only this big, right? If I wrote on this part, I'm going to end up cutting off my excess. So this is going to stay on the patient no matter what. So I like to start right there. Normally we write the patient's name, but since we don't know it yet, I'm just going to go ahead and put our information, and then when the patient gets here, I'll add it on the end. So I'm just going to write Pima and the phone number. We don't put Forever Home Dog Rescue's number on here, we put ours. And if you are having a hard time finding it, it's on a few of the forms, like your SOAP form, for instance, in your chart. It's right there. And then I'll just leave it like that and write the animal's name once they come in. My cage card. Preferably use pen. The Sharpies bleed through and then we can't reuse the other side. But you do want to try to write kind of big so everything's pretty legible. The name's going to go on here. I don't have it yet though, but I will go ahead and write FHDR up here in the corner because I do know that. I don't know breed, sex, or anything like that, but I do know that they're having surgery on Wednesday. So there's really nothing else. I don't even know what kennel I'm going to put them in, so don't have any of that information yet. But again, it's all about getting as much as you can prepared. So we're still waiting, and they haven't shown up yet. So one last thing I can do is I can prepare my basket. Now I won't be able to add things like syringes and stuff because I don't know the size, but I can go ahead and prepare for the stuff that I need today. So, walk over